as the coordinator for Smart Supports. I oversee the daily management of the Smart Supports team, which currently includes 1.5 peer mentors, a resource worker and a resource information assistant. Within our team, we work across both operational and developmental areas of technology-enabled care. We predominantly work with the operational side, which includes referral processing, dealing with inquiries from workers and problem solving. Myself and the peer mentors also work with more bespoke areas and requests from workers, which require joint visits and researching into equipment that might be required that might help the person. It also leads to a more in-depth solution, which would require an ongoing level of work from ourselves. I would like to see us spending a lot more time on the researching aspect for technology-enabled care solutions, trialling equipment and working directly with suppliers. It is something that we need to work on, the divide on how that works, but in current climate, the operational side takes our need and demand. For ourselves here in Smart Supports, it's twofold. One aspect would be crisis intervention, and at the other end of the scale would be the early planning for prevention and intervention. So at crisis point, workers would come to our team for help when the more traditional aspects of care planning aren't fitting the needs of the person that they're working with, and something has happened where they need extra support. So that might be adding in traditional aspects of technology-enabled care alongside care at home service. And then the other side, where we do the early prevention and intervention work, we work alongside the workforce and get involved really at the beginning of a person's journey for care planning, where we get involved with things like activity monitoring whilst the worker is doing their assessment, and then we can build up on equipment that they would need or require for their current situation. There are a couple of points that raises a few challenges for us, which would be timescale. There's often not very much leeway in the timescale that we're given to help someone. It can prevent us providing something quickly. Need and demand on our team. There's only so many of us and we like to get involved in a whole array of work, but urgency and priority take precedence. Workers' understanding of the limitations of technology is also a challenge when it comes to crisis intervention. Technology is wonderful and it can help on many various levels. However, it is not the answer for everything, and it might need a more blended approach where technology is part of the solution. It might not be the whole solution. The challenges for the early intervention and prevention side of the work, we can receive referrals from many different teams within the partnership, and that goes across adult and older services, children and families, learning disability and mental health, home from hospital, a huge array. So again, it's the needs and demand from our service. Again, timescales, it's a longer term piece of work, but it's just getting things in a timely manner where everything works together. It's not just ourselves and the workers, there's also a technician service, the needs of the family. If someone's at hospital, there's a whole chain of events that occur for something to go from referral to installation in someone's house. In East Ayrshire, I would like to see us working alongside the housing service more. So we work with the supported accommodation service at the moment, who are redesigning care plans and building more telecare specific provisions for residents within East Ayrshire. People would need to think quite carefully about the size of the team that they have. We work towards a peer mentor model, which shows we've got a visual for that, so we can give that to the teams so that they know that we're here to help them. We're not a hindrance to their work, we're only here to enhance and help them along the way. Continuous learning and development is huge. We never stop researching and learning. We're always looking for something, no matter how big or small. So having good links with your other teams in the council is invaluable. SDS is huge. In our overarching team, the Thinking Differently team, we have many work streams. So I work in the smart support side and I work alongside colleagues in SDS, and we work together quite regularly. And as part of workers producing SDS assessments and budgets, we will always think about how technology-enabled care can provide an outcome for residents and service users within East Ayrshire.